Hi, my name is Whitney Gorn. I'm going to be discussing ankylosing spondylitis. The reason I'm going to discuss it is because I have ankylosing spondylitis, and it was something I wanted to learn about. So I'm going to show you some of the things that I've learned about the disease. What is ankylosing spondylitis? It is an inflammatory disease. It affects many areas of the body, with the spine being the main one. Over time, it can cause the vertebrae to fuse together, and it is also called axial spondyloarthritis. The other areas that it affects are your peripheral joints, hips, knees, ankles, shoulders, elbows, wrists, hands, your ribs, your eyes, your skin, your bowels, and your heart. The other symptoms will be discussed a little bit later. Here's an example of a healthy spine. As you can see, there's big gaps between the vertebrae, which is normal. And here you can see there are no gaps really. The front side of it has been fused, and there's very little disc space. So these are some of the other symptoms. Stiffness, inflammation, pain in those joints that mentioned before. Your ribs can be affected, and it makes it difficult for you to take a deep breath, making exercise very hard. You can get eye inflammation, fatigue, loss of appetite, which causes weight loss, psoriasis, IBS, heart problems such as having your aorta become inflamed and enlarged, which causes aortic valve distension, or, changing the shape of it, and causes it not to work right. And then your bones can get weak in the beginning, in the early stages of the disease, and cause compression fractures. I had a form of that. My bone got weak, the cartilage connecting your collarbone and your sternum, and it caused it to pop off, and it hurt. Now, what causes it? Scientists are not 100% sure. They have found that those who have ankylosing spondylitis have a gene called HLA-B27, but not everyone who has that gene will get ankylosing spondylitis. Typically, they've found that the people who have it have a family history of rheumatoid diseases, especially ankylosing spondylitis, are before the age of 45, and often have another disease such as Crohn's, ulcerative colitis, or psoriasis, or have attained an injury while having some of these other, contributing factors. They're currently researching the other genes, but have not found any yet other than the one gene, HLA-B27. So how do we treat this? It can be treated medicinally with tumor necrosing factor blockers. It can be treated with interleukin-17 inhibitors, Janus kinase inhibitors, or disease-modifying antirheumatic drugs. Now, those are the first ones you're going to get, and the one I'm going to talk about the most, which is methotrexate. That's the generic name for it, or the chemical name for it, and it's under the name Trexol, Reditrex, a few of those. That's the one that they give you, and you take it typically once a week. 2.5 milligram pills. And that's what they give for everyone who has rheumatoid diseases, not just ankylosing spondylitis. You can also take over-the-counter NSAIDs like Aleve and Advil. Here's a picture of methotrexate, and here's the little pills. And the other treatments, the non-medicinal treatments, are physical therapy, which helps improve your mobility, flexibility, and strength, and helps relieve some of the tension and stuff in your muscles, which is also why exercise is recommended for this. Occupational therapy in those who are severely affected by the disease, and it's different from physical therapy in that it's to help you improve your independence, how to live independently without someone taking care of you with your disease, such as learning to use a mobility device or alternate ways to do your daily tasks without worsening the discomfort, or in ways that you are physically capable of doing. The final treatment for it, or like the worst case scenario, last resort, is surgery. They'll go in and cut your spine, the bone spur, the fused part of it, they'll cut that off, and hopefully it won't actually damage your spine. Sometimes that will damage your spine and make you paralyzed. An example of someone who had this procedure done is found in the video The Folded Man. It's a Chinese video. I've included the link below if you'd like to watch it. And here is an example of one of the physical therapy treatments that may be done. That's something that I did very similarly. They pull your knee in one direction and push your hand in the other, and they use it to stretch and strengthen your spine. Here's a list of some of the doctors that treat ankylosing spondylitis and its symptoms and the different, diseases that occur, with it. Your more important ones are going to be the rheumatologist, who's the main treatment for the disease, an orthopedic surgeon if you have a really severe case, your physical therapist, your occupational therapist, and your primary care provider. Something interesting to know about it is that it may be expressed sexually dimorphically. Males and females have completely different, expression of the disease, it seems. Women report higher levels of pain and inflammation, but have a slower rate of having, their vertebrae fused, whereas men, their vertebrae fuse really, really fast and really, really bad, but they don't really report the high levels of pain and inflammation. They're finding differences in immune responses in the males and females, which may, contribute to that, but they're not sure exactly. They think more research is needed, and it may help personalize treatment in the future. So as I mentioned before, why did I choose this? It's because I have it. And my experience was unpleasant. I found out about it when I broke my collarbone. And then when I was sent to a rheumatologist, he didn't really believe that I had it. He diagnosed me with fibromyalgia and, was like, just go home. You'll be good. For 4 years, I dealt with it and struggled because I was treating myself as if I had fibromyalgia and doing those treatments, but it's not really the correct ones. Eventually, my body gave out on me and it was really bad. And I had developed the amount of stress I had to cause me to develop PTSD over it, which eventually led to seizures. And it wasn't a very pleasant experience. And apparently that happens a lot. Well, that's the end of my presentation.